Hello, welcome to Knowledge Park, the female breast part 2. Today we look at the female breast, the mammary gland, an amazing, often misunderstood organ of the body. We've seen what can go wrong. Now, what you can do. Let's start with everyday food choices that support breast health. Embrace cruciferous veggies, broccoli, cauliflower, cabbage. Their indole-3 carbinol helps shift estrogen toward healthier metabolism. Add berries and colorful fruits, blueberries, strawberries, pomegranate. Antioxidants help lower oxidative stress. Choose omega-3 fish like salmon or sardines, steady anti-inflammatory support. Plant options count, flax seeds and walnuts. Sprinkle on oatmeal, salads, or blend into smoothies. Build fiber daily, whole grains, dal, rajma, and plenty of vegetables. Fiber helps your gut bind and eliminate estrogen, one reason steady intake matters. Use turmeric. Curcumin is a strong anti-inflammatory spice. Practical tip: bloom turmeric in warm oil with black pepper. Stir into dals, eggs, or veggies. Simple plate: half vegetables, a quarter protein, a quarter whole grains, plus healthy fats. Easy swaps: whole grain roti for refined, nuts or fruit for pastries, yogurt for creamy sauces. Hydrate for digestion and energy, water, unsweetened tea, or light infusions. Limit processed meats, sausages, bacon. Preservatives are linked with higher risk. Go easy on ultra-processed and refined foods. They can drive inflammation and weight gain. Choose sweets thoughtfully. Keep pastries and candies for occasional moments. Alcohol risk rises with dose. Less is safer. Some may choose to avoid it. Skip sugary drinks. Pick water or unsweetened options instead. Be kind and consistent. Small, steady steps are powerful. Personalize with your clinician, especially if you have specific needs or conditions. Recap: embrace crucifers, berries, omega-3s, fiber, turmeric. Limit processed meats, ultra-processed foods, alcohol, sugary drinks. Next, pair food with daily habits, movement, better sleep, and stress care to keep the system running well. Intermittent fasting or gentle calorie restraint can raise autophagy, the cell's cleanup and recycling system that removes damaged parts. Epigenetics: lifestyle changes how genes are read, without changing DNA. Green tea, EGCG, epigallocatechin gallate, and crucifers can influence DNA methylation, potentially quieting oncogene activity. Sulforaphane acts as an HDAC inhibitor. HDAC means histone deacetylase and can help re-express tumor suppressor genes. After menopause, adipose aromatase converts androgens to estrogen. More central fat means higher estrogen acting on the vitamin D receptor pathway as well. Movement and breathing. We'll use simple motion and calm breath to support breast health. Regular exercise helps manage weight, which lowers adipose-derived estrogen exposure. It improves insulin sensitivity and keeps metabolism steady. It also lowers systemic inflammation and supports circulation. And it lifts mood, helping stress hormones stay in check. Cardio target: about 150 minutes weekly of moderate work, or 75 minutes vigorous. Moderate options: brisk walking or easy cycling, spread over at least 2 days. Vigorous options: jogging or interval rides. Adapt to your ability and current health. Short sessions count. Stack 10 to 20-minute micro bouts through the week. Add strength training on 2 or more days. Whole body focus. Include chest and upper back work, push-ups, chest press, and rows to support posture and the underlying muscles. Form cues: keep a neutral spine, use a comfortable range, and breathe smoothly. Add gentle mobility and stretching for shoulders and chest. For stress, yoga and pranayama help. Chronic stress raises cortisol and can disrupt hormones. Brahmari, bee breath. Inhale softly. Exhale with a gentle hum. Try 4 to 6 easy rounds. Anulom vilom. Alternate nostril. Close right with your thumb. Inhale left. Switch. Exhale right. Repeat gently. Safety first. Stop if dizzy, skip if congested, and consult your clinician when needed. Breathe smoothly through the nose. Slow exhales calm the heart rate signal. Start small, 5 to 10 minutes, then build up each week. Pick activities you enjoy. Consistency beats intensity. Mix cardio, strength, and mobility for a balanced week. Keep recovery days easy. Sleep and hydration support adaptation. Returning after pregnancy or surgery. Progress gradually with professional guidance. Simple rule. Move most days. Breathe slowly every day. These habits gently steer hormones, inflammation, and mood toward balance. Your pace, your path, consistency is the power. Build a week you can repeat, one you enjoy. Movement plus breath, small, steady steps that add up. Next, we continue with clinical insights, so you're prepared to act when needed. Stay attentive, not alarmed, and keep moving. Essential healthy habits. Calm, practical steps to support breast health. No alarm, just guidance. Begin with self-breast awareness. Know your usual look and feel. Regular self-check. Do it monthly. If you menstruate, check on days 5 to 10 after your period starts. If post-menopause, pick the same date each month. Step 1. Visual check in a mirror. Arms at sides, then raised, then hands on hips. Look for new asymmetry, skin dimpling, rash, nipple inversion, or contour change. Step 2. Palpation standing or in the shower. Use the 3 middle fingers in small circles with light, medium, and firm pressure. Follow a spiral or grid to cover collarbone to bra line and armpit to breastbone. Step 3. Lying down. Place a pillow under the shoulder on the side you're checking, arm behind head. Repeat the same circular pattern. Gently check the nipple for unexpected discharge. Note any new lump, persistent thickening, skin change, discharge, or nipple pull-in. Recheck in 1 week. If persistent, see a clinician promptly. Notice monthly patterns, normal fullness or tenderness. So new, persistent changes are easy to spot. Why breast problems occur? Hormonal shifts, blocked ducts or infection, trauma or friction, dermatologic conditions, and benign cysts or fibroadenomas. Cancer risk factors include age, family history, or BRCA changes, prior chest radiation, dense breasts, long lifetime estrogen exposure, obesity, alcohol, and inactivity. Most changes are benign. Use monthly self-checks plus age-appropriate screening to catch important issues early. Red flags. A new lump or an area of thickening that does not go away. Also note skin dimpling like orange peel, or a nipple that turns inward. During sexual arousal and foreplay, breasts often swell slightly from increased blood flow, called vasocongestion. Nipples usually become erect. The areola may darken and look fuller, and sensitivity rises. These changes are normal and fade after arousal or orgasm. Responses vary by person, cycle day, and hormones. Gentle touch, adequate lubrication, and clear consent help avoid irritation. If an area is already tender, use lighter pressure or a different focus. See a clinician if pain is persistent, bruising appears without clear cause, swelling or redness lasts more than a day, there is discharge, or a new lump remains after arousal settles. Latest research and findings. a brief, steady tour of how care and detection are improving. Personalized medicine tests tumors for HER2, human epidermal growth factor receptor 2, estrogen receptors, and progesterone receptors. Treatments then match the profile. Immunotherapy helps your immune system find and attack cancer. Checkpoint drugs and other tools are options in select cases. Liquid biopsies look for circulating tumor DNA, ctDNA, in blood. Useful for tracking response and catching recurrence with fewer invasive tests. The microbiome is under study. Links between gut bacteria, inflammation, and estrogen metabolism may influence risk. Takeaway: research is moving fast, care is more targeted, tests are gentler, and biology clearer. Discuss choices with your clinician as evidence grows. Watch for new scaling or a rash that won't heal, and for discharge, especially bloody or spontaneous clear. Don't panic. Prompt evaluation is wise. Screening. Follow local guidance for clinical exams and mammography. A mammogram is a low-dose X-ray that can find changes too small to feel. Higher-risk people may start earlier and add MRI, magnetic resonance imaging. Plan this with your clinician. Avoid smoking. It raises cancer risk, including breast cancer. Quitting helps at any age. Breastfeeding, when possible, can lower lifetime estrogen exposure. Helpful, never pressured. Supportive habits, regular sleep, dark nights, and simple stress care routines. Keep a healthy body composition and move often. This steadies hormones and inflammation. Checklist. Know you're normal. Note persistent changes. Follow screening. Don't smoke. Consider breastfeeding. Sleep well. Manage stress. Keep moving. Most breast changes are benign. When unsure, get checked. Partner with your clinician to personalize timing, follow-up, and support. Where to go? Start with your general physician. They may refer you to a gynecologist or to a surgical oncologist who focuses on breast diseases. Many hospitals have dedicated breast clinics. The breast is a remarkable system. Understanding its anatomy, physiology, and daily supports empowers you. Knowledge is a strong first step toward well-being. For average risk, mammograms often start around ages 40 to 50, then continue as advised. Gentle close, steady habits, awareness, screening, smoke-free living, good sleep, stress care, and movement. Support long-term breast health. AI in radiology helps flag subtle mammogram patterns as a second reader. Diffuse optical tomography studies, tissue oxygenation, functional, non-ionizing imaging under research. Nanoparticle drug delivery aims treatments at tumors. Antibody-guided carriers focus chemotherapy on cancer cells. CAR-T for solid tumors is being tested. Engineered T cells against targets like ROR. One show early promise. Theranos-Tix pairs. Tracer imaging with targeted radiotherapy. Confirm binding, then deliver treatment. We've mapped the machinery. Now, how to keep it running well. Circadian alignment. Prolactin and oxytocin follow your body clock. Keep a regular sleep-wake schedule. Keep nights dark to steady hormones and milk. This may lower inflammation during involution. Metabolic foundations. Protein plus complex carbs fuel casein and lactose. Latch and positioning. Chin to breast, wide mouth, and an asymmetric latch. Adjust until it feels comfortable and pain-free. Choline supports membranes and lipid transport. Pumping cadence. In early weeks, empty every 2 to 3 hours. Later, match your baby's demand to maintain supply. Nipple care. Brief air dry after feeds. Avoid harsh soaps and rubbing. For soreness, use warm compress before feeding and cool compress after. Effective emptying drives. Production. Micronutrients: iron, B vitamins, iodine, zinc. Lows here can impair synthesis and repair. Pump fit: correct flange size prevents friction. Gentle suction is often enough. Load management: remove milk often to keep the prolactin signal. That prevents stasis and lowers mastitis risk. It also blunts inflammatory cascades in involution. Exercise and alcohol: regular movement boosts insulin sensitivity. It nudges AMPK up, AMP-activated protein kinase, and mTOR down, the mechanistic target of rapamycin, calming estrogen and inflammation signals. Medication safety: confirm lactation-compatible drugs with reliable databases or your clinician. Supportive bras matter. Ensure proper fit. Skip underwires if areas are sore. Ergonomics: keep neck and shoulders neutral. Use pillows for relaxed positioning. Gentle shoulder and upper back stretches ease tension from holding positions. Stress circuitry: chronic stress lowers oxytocin and disrupts letdown. Use brief relaxation. Add skin-to-skin contact. Keep warm. Predictable routines normalize reflexes. Lifespan lens: in utero and puberty, early exposures set risk. Pregnancy and lactation: full-term parity matures the gland. Breastfeeding when possible adds protection. Menopause: involution and fat-derived estrogen shift risks. Match habits and screening to your life stage. Bottom line: live with your clock. Feed the machinery well. Move regularly. Keep alcohol low. Manage stress. Keep the ducts flowing. Small, steady habits tune the same pathways that power lactation and protect long-term breast health. Daily habits tune biology. Life course lens: in utero and puberty exposures can set later susceptibility. Pregnancy and lactation: full-term parity matures the gland and can be protective. Menopause: involution and adipose-derived estrogen shift risks. Match habits and screening to stage. Thank you for watching. Please like, share, and subscribe.